The goal of CHAMS is to actually track and profile preventable causes of death among children under 5, which actually would be more useful not only in Kenya but globally to understand what is the main causes of death among children under 5. And to do this, we need to ensure that we are able to pick samples and test them from children who die, because that's the cheapest way that we can actually know what causes death in these children. Combine that with clinical records and patient history, and have this information actually digested and debated upon by a panel of experts that I would actually briefly talk about. So the Midspan is one of the tools that we use to enroll children who die in this study and who we need to take samples from to be analyzed. So the minimal invasive sampling procedure van will be used for child mortality prevention surveillance, which, as I have said, aims to understand the track the preventable child deaths. This van was actually, plus its accessories, was bought at a cost of $70,000 USD by our fiduciary agent, HJF. So the Midspan concept was emanated from challenges that we encountered in enrolling MIDS cases or children who die into this study, because sometimes when we go to the community, we have communities where a child has to be buried quickly after death. We have communities where the health facility setting where the child dies do not have a morgue, so pathologists cannot actually perform minimal invasive procedure, that is taking blood samples using some needles. We engaged with Gates Foundation, who are actually supporting this study, and Kenya was given the first chance to pilot this. This is the first of its kind, not only in Africa but also in Asia or globally, to see how a minimal invasive procedure van can be used to engage with communities to have their children enrolled in a study which has to take samples from a dead child within 24 hours. Because if the child has to be attended to, or if we have to take samples beyond 24 hours, the child would have decomposed, so we will not be able to actually get the actual pathogens or possible causes of death. So the project is being implemented by KEMRI in collaboration with the Ministry of Health, County Health Management of Kisumu and Siaya, and through funds managed by Henry Jackson Foundation and support from CDC and Emory University, and also we have Liverpool University also currently involved in this. So today is the official day to have the van handed over by Henry Jackson Foundation to KEMRI, having been supported by Emory University and Gates Foundation to buy it.
Here we are going to witness what Professor Amoda has told you. One of our flagship projects is that when you are in communities, when children die, or even when adults die in our communities, the cause of death is usually not known. But we always have to be able to transport the body all to the morgue, to the mortuaries. And it takes time. And those mortuaries may not be available at a community level. And it's very critical for us to know what has killed that person, so that we can be able to bring interventions to those ones who are living, and also bring other particular specific interventions. So this project, which have been supported by Bill Gates and which our team has really been working on, has been to actually have this van right at the village level. When there's a death, then immediately when the team is activated to go and take the samples, then from that they can be able to inform not only the ministry, but we can also inform the community and even the households.